Hey guys, thanks for joining us again for our third nutrition video. Today's video is going to be about the B vitamins, kind of introducing us to the micronutrients. I'm just going to get my PowerPoint set up here. Okay, so the B vitamins. First, micronutrients are a chemical element or substance that are required for normal growth and development of living organisms, including us. Essentially, these are going to be your vitamins and minerals, as well as trace elements, electrolytes, things like that. As we talk about each of these, we're going to be talking about the Recommended Dietary Allowance, or the RDA, which is the recommended daily intake for average adult men and women, and the tolerable upper intake level, or the UL, which is the maximum dose that's unlikely to cause adverse side effects. So essentially the upper limit of what you want to take in. So vitamins can be found in a healthy nutritious diet. We can always find all of the vitamins we need if we're eating the way we're supposed to. There are actually 8 B vitamins, and they're all water soluble, meaning any excess that you take in will be excreted through the urine, and they are all necessary for normal metabolism and development. The B vitamins are also present in all fortified foods. So if you ever hear about fortified, that just means that they're enhanced in order to have these extra vitamins that are necessary. The FDA did that in order to make sure that we don't become vitamin deficient because a lot of us don't eat the fruits and vegetables that we need. So they kind of added it into the cereals and breads that most families will eat. Vitamin B1 is also called thiamine, and thiamine is involved in the breakdown of nutrients for energy, which we know is metabolism. A deficiency in thiamine can actually lead to malfunctioning of the brain, the heart, and your muscles. So it's a pretty serious complication. Most people, most average adults are not going to be vitamin B1 deficient, but there are some things that can increase your risk, such as poor oral intake. We think about elderly people who don't eat a whole lot, decreased intestinal absorption, so problems with the gastrointestinal organ system, and alcohol abuse as well. Really, alcohol abuse puts you at risk of deficiency in all of these things because when you're drinking alcohol in excess, you're actually urinating more and you are losing all of these vitamins through the urine. The recommended daily allowance is 1.1 to 1.2 milligrams per day. There is no upper limit for vitamin B1, and that's again because you will excrete any excess that you take in through your urine. Food sources for vitamin B1 include beans, lentils, seeds, peas, yogurt, fish, and pork, as well as whole grain rice, breads, and pastas. And for each of these, I'm going to have a little nugget of knowledge or a fun fact. And I've got a little chicken nugget on the side, so hopefully that'll keep people's interest. Interesting fact for vitamin B1, in 1884, a Japanese physician actually noticed high rates of illness and death among the Japanese sailors that were only eating refined rice for months. When given a more varied diet with whole grains, meats, beans, vegetables, the rates of illness and death actually disappeared. And this led to the discovery of thiamine. At that time, they were actually refining the rice, so they were actually eating this white rice, which is not a good source of thiamine. You have to have those whole grains. So next is vitamin B2, riboflavin. I don't actually know how to say it, I'm not going to lie. It is involved in energy production and the breakdown of fats and medications. So again, each of these vitamin Bs are going to be important for normal metabolism. A deficiency in vitamin B2 can lead to various health problems, including migraines and cardiovascular disease. And we know that's things like heart attacks and strokes. There is an increased risk of deficiency in this for vegans and vegetarians, as well as pregnant women. Really, for all of these B vitamins, there is an increased risk of deficiency in pregnant women because they're going to have an increased need, an increased requirement from other average adults, adult men and women, because they are, of course, eating for two, so they're going to have more vitamins than other people. You have the recommended daily allowance there. Again, there's no upper limit. Food sources for this include dairies like milk, yogurt, and cheese, eggs, lean beefs, organ meats, chicken breast, salmon, almonds, and spinach. Nugget of knowledge for vitamin B2. If you've ever wondered why milk is no longer stored in glass bottles, it's because it was discovered that if milk is exposed to too much light, the vitamin B2 in it will actually be deactivated from its usable form. So all those dairy products, they were not actually rich in the vitamin B2 as they should be. And so this is why milk is now sold in those plastic gallons, which are cartons that are opaque, plastic containers that actually block out the light. So that's fun. Vitamin B3 is niacin. This is also called nicotinic acid or nicotinamide, and it can be converted from tryptophan, which is one of those amino acids that we talked about. In addition to aiding with metabolism, niacin also helps cells make DNA, which is your genes, and is also an antioxidant. So what are antioxidants? They are substances that actually block a chemical reaction in your cells, which can lead to cell damage and production of free radicals. Free radicals are bad. Free radicals will increase your risk of developing cancer because they do cause cellular damage. So antioxidants, in effect, decrease your risk of developing cancer. So these are good things. A severe niacin deficiency can actually lead to cognitive decline and memory loss, so essentially dementia. RDA is 14 to 16 milligrams, again, no upper limit. And food sources for niacin include meats, poultry, fish, whole grain, brown rice, nuts, seeds, legumes, and bananas. So again, most of these vitamins you're going to be getting if you're just eating that healthy, nutritious diet that's a moderate consumption of all of the healthy food categories. Nugget of knowledge for vitamin B3. Niacin was actually previously used to help treat high cholesterol. However, more recent studies haven't found really much benefit compared to other medications like Lipitor. So they don't really use it as much anymore. Vitamin B5 is called pantothenic acid. It is used to make what's called coenzyme A, which helps with fat metabolism, so the breakdown of fats. The RDA is 5 milligrams a day, no upper limit, and food sources you can see here. Again, you're going to be talking about your meats, dairies, whole grains, and fruits and vegetables, nuts, and seeds. Nugget of knowledge, vitamin B5 supplements are marketed to help a wide variety of conditions. I mean, from allergies, dandruff, leg cramps, arthritis, but there is actually little evidence to support these claims, so I would take it with a grain of salt, figuratively. Vitamin B6 is called pyridoxine. It is helpful with metabolism, of course, but also supports immune function and brain health. The RDA is listed here, and there actually is an upper limit for vitamin B6, which is 100 milligrams daily. As you can see from the RDA, that is almost 100 times what is recommended, so that's pretty rare unless you're taking excess supplements. Excess of this can cause toxicity, which will have its own effects. Food sources, as you can see here, again, you get a lot of the same things. Fortified cereals, as I said at the beginning, all of fortified foods will have these vitamins impacted into them. And we talk about our dark leafy greens here as well. Nugget of knowledge for vitamin B6. We actually recommend that pregnant women who have pregnancy-induced nausea take vitamin B6 as a way to kind of help them with their nausea. And so I mentioned the dark leafy greens. What does it mean when we say that? We like to say that a lot as physicians. Your dark leafy greens are as follows. Your broccoli, asparagus, Brussels sprouts, any of the greens, like turnip greens, collard greens, mustard greens, radish and dandelion greens, as well as some other types of lettuce like bok choy, kale, arugula, romaine, spinach, Swiss chard, watercress, So anything that's dark green essentially is going to be considered a dark leafy green. A lot of people eat iceberg lettuce as their salads, and that is not included as a dark leafy green because that is essentially water. So if you want a nutrient dense form of leafy greens, this is what you want to go for. Vitamin B7 is called biotin. In addition to metabolism, biotin also helps regulate cell communication and the activity of your genes. A deficiency in biotin can lead to thinned hair and brittle nails. However, because of the deficiency causing those symptoms, we like to think, oh, okay, a biotin supplement then will help prevent that. But the studies of this have actually been inconclusive, and the studies that did show benefit had pretty weak evidence. So again, with vitamin supplementation, it's kind of it might help, it might not, kind of you just make your own decision there. I actually do have some biotin gummies here for hair, skin, and nails, and you want to look at the amount of biotin that's in it. So as you can see here, the recommended daily intake is 30 micrograms per day. And in this particular biotin supplement, it has 2,500 micrograms per day, which is 8,333% of your daily value. So this is way more biotin than you actually need. So I would, again, just know what's going on when you take these supplements. Food sources, again, you've got as you can see here, all of the things that we've talked about. Nugget of knowledge, foods that are made with raw eggs, things like mayonnaise, Caesar dressings, and eggnog around the Christmas time, they actually contain a protein called Biotin, which prevents the absorption of biotin. So if you're eating a ton of these kinds of foods made with raw eggs, it actually can prevent your absorption of biotin. So you want to be careful about that, especially if you are having those symptoms of deficiency. Vitamin B9 is called folate, also known as folic acid. In the supplement form is actually better absorbed than that from food sources, which I thought was interesting. In addition to metabolism, it helps produce healthy red blood cells, and folic acid is critical during periods of rapid growth, such as during pregnancy. The recommended daily allowance for average adults is 400 micrograms per day, and the upper limit is actually 1,000 micrograms a day. You really want to be careful when you take supplements for not taking too much, just because that can cause unwanted side effects. So if you are going to be taking a supplement, I would recommend picking up the 400 micrograms daily type of folic acid. For pregnant women, it can be 600 to even 800 micrograms a day. I would talk to your healthcare provider about that. But again, knowing that the supplements are more readily absorbed than those from food sources. As you can see here, food sources, again, are pretty similar. Nugget of knowledge, folic acid deficiency can lead to neural tube defects like spina bifida in the first 3 weeks of pregnancy. That's pretty early. I mean, that's before most women even realize that they are pregnant. And that's why we actually recommend all women who become pregnant take a daily prenatal vitamin, which will have that amount of folic acid that they need. So that's important to know. Vitamin B12 is also called cobalamin. It plays a vital role in development of brain and nerve cells. Is also needed to form red blood cells in your DNA, your genes. So it's pretty important. There are vitamin B12 injections that used to be pretty popular, and a lot of our elderly patients still come in requesting it, but actually most recent studies have shown that your gut absorption, so oral supplement, is just as good as the injections. And the only time you would really need the injections is if your gut absorption is impaired. So if there's some reason that you can't absorb it normally. The recommended daily allowance for this is 2.4 micrograms per day, and the upper limit is none. So again, you will excrete out any excess that you take in. Food sources, as you can see here, a lot of the same things. So again, if we're taking in the right types of nutrients, we're going to be getting all of these micronutrients that we need. Nugget of knowledge. A lot of times the vitamin B complex is marketed as an energy pill. And while it can correct anemia in those with a vitamin B12 deficiency, there's actually been no evidence showing benefit of supplement in those who are not deficient. Again, talk to your healthcare provider. Sometimes we will do it if your levels are kind of the low end of normal, but as marketed as an energy pill, if you're not really deficient, it's probably not doing a whole lot for you. And this is the reference that I used for all of these recommendations. So that's all I have for today. I'll try to be doing another video in the next couple days since I was pretty late this week. And next time we'll be talking about the other vitamins other than vitamin B. So tune in. Thanks, guys.